Sam Asirvatham, one of the cardiac electrophysiologists. So that's a cardiologist who specializes in heart rhythm disturbances. Most of my work is treating patients who have either a very fast heart rate or a very slow heart rate. And a common cause of a fast heart rate that I do a procedure called an ablation procedure for is atrial fibrillation. Now, radiofrequency ablation, the most common type of ablation for atrial fibrillation, started over a decade ago. Physicians in a center in France were the first to show benefit of this type of procedure. After that, some of the larger centers, the centers where a lot of procedures are done, including Mayo Clinic, adopted this procedure. Today, the procedure is done in many centers, and there are many varieties of this procedure done. At Mayo Clinic, some of the advantages are that we do a lot of these procedures. Being a referral center, a tertiary care center, we have several operators who are experienced in doing this, and more importantly, are experienced in doing the many varieties of this ablation procedure. So there's a better chance that an exact fit for a patient and what procedure they need can be done. There are 4 or 5 other similar centers in the United States, also very high volume and also with many experienced personnel that can do this. Each center has its own specific approaches as well. One of the things that's peculiar to our own approach, and we believe it helps improve outcomes in our patients, is using a technology that was partially developed at Mayo Clinic called intracardiac ultrasound. So to summarize, atrial fibrillation is the most common heart rhythm problem that people can get. Patients will know it from palpitations, and it's diagnosed with an EKG. We have to remember to prevent stroke in patients with atrial fibrillation, usually with aspirin or a drug called Coumadin or warfarin. To help patients lead better lives with atrial fibrillation, we first try medicines, either to slow down the heart rate or to try to keep the heart in normal rhythm. When that doesn't work, the relatively new procedure, when performed at an experienced center, is a relatively safe and effective way with real but minimal risk of serious complications in allowing people to get back to their daily lives.